Hi dear students, today we will see histology of urinary system. There's a class on gross anatomy of a urinary system. You can go back and see the urinary system theory regarding the gross anatomy. Now this class will deal only with histology. So let's see today regarding the kidney, ureter, urinary bladder and the urethra histology. A kidney has a covering called a capsule, which is having two layers, outer layer and an inner layer. Outer layer is made of collagen fibers and there is an inner layer which is mainly myofibroblast. These cells are in between the muscle and the fibroblast called as myofibroblast. Capsule having two layers, outer layer and inner layer. Deep to the capsule, this area is cortex. Let's see the coronal section of the kidney, how it looks. It has got an outer cortex and an inner medulla. Light colored area is the cortex and the triangular shaped structure, pyramidal shaped structure is the medulla. Cortex is covering the basal aspect of the pyramid like structure here, and also it passes in between the triangular structure here called as the pyramid. So there's a cortex and this dark area are called the medulla. The cortex consists of renal corpuscles. Now this structure here is the nephron. Nephron has location in different areas of the kidney, as it is present in the cortex region. Some part of the nephron is present in the cortex region, some part of it is present in the medullary region. Now it's important to know the structure of the nephron before proceeding to the histology of kidney. Nephron has a cup-like structure here called Bowman's capsule, inside which there are glomerulus. They are the capillary networks of the blood vessels which are entering into the glomerulus. I'm sorry, entering into the Bowman's capsule, forming the glomerulus. The tubule which is starting from it is PCT, proximal convoluted tubule. It continues in the medullary region as lymphophenly, again reaching the cortex and forming distal convoluted tubule and collecting duct, entering into collecting tubule. Anyway, I'll be explaining about this in later slides. So let's see what you can see in the cortex. Cortex has renal corpuscles. Renal corpuscles are the combination of the glomerulus and the Bowman's capsule together is called the renal corpuscle. And there are convoluted tubules, straight tubules. The beginning of straight tubules can also be seen. Collecting tubules and the collecting duct can also be seen in the cortex region. Renal corpuscles are round structures which can be seen with the microscope, and they are the beginning of the nephron. And there are capillaries called as glomerulus. So the renal corpuscles includes the glomerulus and the Bowman's capsule, so which can be said as the beginning of the nephron. Now medulla region has lymphophenly, collecting ducts can be seen, and in another capillary network called vasa recta. Vasa recta are again a capillary network which is seen near the loop of Henle in the medulla region, which are actually coming from the glomerulus. So there are two types of capillaries. One is the glomerulus, and the continuation of it is the vasa recta, or the vessels or capillaries which are surrounding the nephron. They will continue as venules and ultimately forming the renal vein. Straight tubules are continuing from cortex to medulla, and looking at the structure of cortex and medulla, some part of the nephron is seen in the cortex, some are seen in the medulla. And because of the particular arrangement of the nephrons inside this area, deeper area, there can be seen as pyramids. So pyramids, inside the pyramids, there are nephrons. There's a particular arrangement of the nephrons which can be seen. And some part of the nephrons can be seen on the outer aspect as well. That is the cortex region. There are 8 to 12 pyramids usually, but it can be up to 18 in number. Now the base of the pyramid, I said that the pyramid is almost triangular in shape. The medulla region has a lot of pyramids. These are pyramids, and the base is facing towards the cortex, and the apex is facing towards the renal sinus. This area is the renal sinus. Now the pyramid can be divided into two parts: outer medulla, which is near to the cortex, and inner medulla, that is towards the renal sinus. Histological diagram of the pyramid looks like this, where this is the tip of the pyramid, which can be seen here, which is opening onto another structure called minor calyx. Minor calyx can be one or two or three. They joins to form major calyx. Two to three major calyces together joins to form the renal pelvis. Renal column of Bertini is medullary extension of the renal cortex between the renal pyramids. I said cortex is present here, which is present on the base of the pyramid. Not only that, it extends into the gap between the medulla, and they are called as renal column. Apical portion of the pyramid has got a projection which is called the papilla and projecting into the minor calyx, as I said before. And minor calyx joins to form major calyx, joins to form the pelvis. Now, tip of the papilla has a sieve-like area where the collecting ducts are opening, and this is called area cribrosa. Collecting ducts are opening at the tip of the pyramid, and that is called the papilla. Now, what is a kidney lobe? Now, the kidney lobe is defined as a medullary pyramid and associating cortical tissue at the base and the sides. So, all of this area, the pyramid, and also the renal cortical tissue at the base and the sides, together called as lobe of kidney. Nephron is structural and functional unit of the kidney. So I was explaining about that. Each human kidney consists of around 2 million nephrons, and which are responsible for production of urine. Now, collecting ducts responsible for the final concentration of the urine. Initially, when the blood is filtrated, there are a lot of things which might be required for the body that has to be absorbed when the filtrate passes through the nephron, through different parts of the nephron. So at the end of it, the urine, the final product, would be concentrated after absorption of necessary things. And nephron consisting of a renal corpuscle, which is a combination of glomerulus and Bowman's capsule, and the tubular system, which consists of proximal convoluted tubule. They are convoluted. They are more convoluted, and loop of Henle, DCT, distal convoluted tubule, which are less convoluted than PCT, and opening into collecting tubule, as I mentioned before. And the collecting duct is collecting tubule is opening at the tip of papillae of each pyramid. So it's a repetition again. The corpuscle is consisting of a glomerulus and the Bowman's capsule together. So the inner layer of the Bowman's capsule is surrounding the glomerulus and continuing as the parietal layer or the outer layer. And let's see the formation of the glomerulus, how the glomerulus is formed. Renal artery enters into the kidney, divides into segmental arteries, ultimately forming smaller and smaller arteries called afferent arteriole, which enters into the Bowman's capsule, and they form network of capillaries in this area called glomerulus. Now, glomerulus, after forming the glomerulus, the arteriole comes out as efferent arterioles, and efferent arterioles, they again going to form another set of capillary network over the nephron. So there are afferent arteriole forming the glomerulus, and from the glomerulus efferent arterioles emerges out. Now let's see the connective tissue of the afferent and efferent arteriole and what happens to them when they enter into the Bowman's capsule. This is again a picture of Bowman's capsule and the glomerulus, outer layer of Bowman's capsule, and becoming inner layer covering the glomerulus, closely attached to the glomerulus, and again continuing as the parietal layer of glomerulus. I'm sorry, parietal layer of Bowman's capsule. Now, the connective tissue over the afferent and the efferent arterioles, they are not going to enter into the Bowman's capsule. They will be left out just before entering into the Bowman's capsule, and they are called as mesangial cells. So mesangial cells are the connective tissue of the blood vessels which are going to enter into Bowman's capsule, and they are specialized here. Mesangial cells. There are two types of mesangial cells, extraglomerular and intraglomerular. As I said before, some of the connective tissue layer of the afferent arteriole, they ends here. They are not going to enter into the Bowman's capsule, and they are modified here called extraglomerular mesangial cells. So they are extraglomerular mesangial cells. And intraglomerular mesangial cells are again connective tissue which are seen inside the renal corpuscle. Intraglomerular mesangial cells. Now, glomerulus is having a double layer of Bowman's cup-shaped structure called the Bowman's capsule. Inner layer and an outer layer, as we discussed before. Inner layer continuing as outer layer. So this structure is called Bowman's capsule. Bowman's capsule is a dilated proximal end of the nephron. The space between the inner layer and the outer layer is called a urinary space. Urinary space. Urinary space. Now the glomerulus, as we discussed, it is very closely contacted or having contact with the inner layer, visceral layer of Bowman's capsule, and here the cells are modified and these cells are called podocytes. And the outer wall is having a simple squamous epithelium, and that is also called the parietal layer. So there is an inner and outer layer. Inner layer is modified to have podocytes. There are some specialized cells there. Outer cells are simple squamous cells. Let's talk about the podocytes. So afferent arteriole entering into the Bowman's capsule, forming the glomerulus, coming out as efferent arteriole. Podocytes are going to cover the glomerulus. Afferent arteriole and efferent arterioles. The extra glomerular mesangial cells, intraglomerular mesangial cells, inner layer of the Bowman's capsule, outer layer of Bowman's capsule. Now inner layer has podocytes which are going to cover the capillaries. Now podocytes have a long tentacle-like cytoplasmic extension called major processes. So there are major food process. Major food process. This is podocyte having a major process, primary process. Now primary process has a smaller process from it called secondary process, called as a food process or pedicles. Now food process can interdigitate with food process of neighboring podocytes or the processes which are arising from neighboring primary process. And the elongated space between the food process, as can be seen here, is podocyte, primary process. It's a magnified picture, primary process, another primary process, secondary process. So there is space between one secondary process and the other secondary process, and this space is called filtration slits, which is allowing ultrafiltration from the blood, and whatever is filtrated from the blood will be entering into urinary space. There are two poles which are related to the renal corpuscle. Vascular pole, where the afferent arterioles enters, forming the glomerulus and coming out as efferent arteriole. And other pole, where the gap between outer layer and the inner layer, called the urinary space, is going to continue as the proximal convoluted tubule. This area. This is urinary pole. Now look at the relation of the renal corpuscle with the DCT. DCT, as it is convoluted, it is having a close relation with the renal corpuscle near the vascular pole. So the first convoluted tubule here is proximal convoluted tubule. They are longer than the distal convoluted tubule and more numerous in the cortex. And PCT is characterized by the inner aspect of the PCT is characterized by the lumen, and lining of it is by cuboidal cells which are eosinophilic, and lumen is comparatively small with the DCT, and there are brush bordered microvilli which are seen near the lumen. So apical surface of the each cell are having microvilli. The renal corpuscle can be seen, and the tubules, the cross sections of the tubules also can be seen. Now DCT is larger luminal structure and with small cuboidal cells. Cytoplasm is less stained and no brush border, whereas PCT staining is a little darker. PCT staining is darker, whereas DCT staining is lighter, and lumen in the PCT is small, whereas DCT lumen is bigger. Why The lumen of PCT is smaller because of the presence of microvilli, whereas here it is absent. And DCT also shows the DCT, one cell in the DCT is focused, where there are deep basal and lateral infoldings can be seen. This is to increase the surface area. So one difference or some differences between PCT and DCT can be seen, where the DCT is having a large lumen and not well stained cells, whereas PCT are deeply stained and the lumen is smaller due to the presence of microvilli in it. There are other differences we will see in the next coming classes.